Hello, Professor. We are Group 2 here to present on the cognitive disorder, and our topic is Parkinson disease. So, to help you understand what happens in the brain, so someone with the Parkinson disease, I would like to start with this visual. So, this picture shows the difference between a healthy brain and a brain with the Parkinson disease. In the middle of the brain, there is a small area called the substantial nigra, as you see on the left side on the picture of a brain. This part makes a chemical called the dopamine, which helps control our body movements. In a healthy brain, the substantial nigra looks darker because it's full of healthy cells that makes a dopamine. As we can see on the top right side, a picture of a healthy brain. But in the Parkinson disease, this area become lighter and smaller, as we see on the left bottom side picture of our brain. That means the brain is losing those important cells, so it cannot make enough dopamine. When that happens, people with Parkinson start having trouble moving. They may shake, feel stiff, move slowly, or have trouble with balance. This is why Parkinson is called a movement disorder as well. So moving to the next slide. So as we've seen that what happens in the brain with the Parkinson. So let's look at the clear definition of the disease. So it is a progressive neurological condition that affects the brain's ability to control body movements. What this means is that over time, the brain gradually loses control over how the body moves, making everyday tasks more difficult. Even though Parkinson disease affects many parts of the brain, as we see in the previous slide, the main symptoms happen because of the damage in one area of the brain called the substantia nigra. This part of the brain has special cells that make a chemical called dopamine, which helps the brain send signal to the body so we can move smoothly and with control. In people with the Parkinson, these dopamine making cells slowly dies, and by the time a person start to notice symptoms like shaking, stiffness, or slow movement, they have already lost 60 to 80% or more of these important cells, as per the study shown. So in this slide, I will be discussing about the signs and symptoms of this disease. So the first symptom is a slow movement, which is also called bradykinesia. This means that everyday actions like getting dressed or brushing hair can take much longer than usual. The next one is the Parkinsonian gait. This is the way someone walks when they have Parkinson. They may take small, shuffling steps and not swinging their arms while walking, or have trouble stopping once they start. Rigidity means stiffness in the muscles. It can make it hard and painful to move arms or legs, and the person may feel like their body is tight or frozen. Then there is a face masking. This means the person's face doesn't show a lot of emotion. They may look serious or blank, even if they are feeling okay inside. The next one is the tremors. That's are the common, especially in the hands or fingers. The shaking usually happen when the person is resting and can make it harder to hold things. The another symptom is slowed reaction time. This means uh, slow reaction time. This means the person takes longer to respond or react, which can affect how they move or answer questions. The lastly is because of the poor balance and the stiffness, people with Parkinson may have frequent falls. This is dangerous, especially for older adults, and increase the risk of injury. So in this slide, I will be talking about the causes. So the cause of Parkinson disease is unknown, but several factors seems to play a role. The first one is a genetic. In most people with the Parkinson disease, there is no single gene or clear genetic reason that causes it. But in about 5 to 10% of cases, the Parkinson is caused by a change or mutation in one specific gene. These gene changes can be passed down from parents to their children, which means the disease can run in families. Studies shown that about 15% of people with Parkinson have a family history of the disease, meaning someone in their family also had it. Age-related causes. So getting older is the biggest risk factor for Parkinson. Most people with the Parkinson are over the age of 60. As we age, the brain naturally slows down and the cell that makes dopamine may become weaker or die. This makes older adults more likely to get Parkinson than younger people. Last one is the environmental factors. There are some environmental factors that can increase the risk of getting Parkinson disease. These include long-term exposure to things like pesticides, polluted air, factories, chemical, and contaminated water or soil. These harmful substances can damage brain cells, especially the one that helps control movement. People who live near farms, factories, or in areas with population may be more at risk. While these things don't directly cause Parkinson on their own, they can raise the chances, especially in older people or those with certain genes. So next one, I will hand over to Navro.
Yeah, thank you, Serena. I will discuss from the treatments. So, while there is a no cure for the Parkinson disease, but there are various treatment which helps to manage the symptoms and improve the quality of life. The first one is physiotherapist, which is support mobility and balance, while speech and language therapy helps with the communication and swallowing. So next is the physiotherapy support such as counseling or therapy, which address depression and anxiety, which is common in Parkinson client. Next is medication like levodopa, which convert to dopamine in the brain as the key in the reducing symptoms such as tremors and stiffness. The other drug may also be used to support dopamine function. These treatments work together to help client maintain their independence daily functioning. Next slide, please. Okay, so next are safety measures. Client with Parkinson disease often face challenges related to movement, coordination, and cognitive decline, which can increase their risk of falls and injuries. As a support worker, it is important to implement safety measures that promote overall well-being, encouraging a healthy and balanced diet rich in nutrients, especially omega-3 acid can support brain health and potentially slow cognitive decline. Next is regular exercise, which is also very essential for the Parkinson disease client, as it helps to improve muscle strength, flexibility, and balance, all of which contribute to better mobility and reduce risk of falls. So these interventions not only enhance physical health but also support a higher quality of life for client living with the Parkinson disease. Next slide is. So moving further with the safety measure, so the next is fall prevention. To help fall prevents, it is important for HCA not to rush and avoid multitasking while handling your client, and always use a handrail when available. Next is proper lighting, which should be used in the client room, and hazard like throw rugs, rolling chairs, and exposed cords should be removed. Support worker can assist with the daily living activities through occupational therapies, which support tasks like dressing, bathing, and cooking. So next is speech therapy, which may also be needed to improve manage issues with the swallowing and communication. Next slide, please. So next is the role of support worker. So support worker play a very important role in enhancing the quality of life for client with the Parkinson disease. They can assist with the daily personal care tasks like dressing, bathing, grooming, and toileting, and can help with eating and drinking, especially if a client has swallowing difficulties. So next, they can also support medication management by ensuring proper timing and doses. Next is emotional support. So emotional support is equally important as other, like support worker can listen to their client and validate their feelings and encourage social interaction to reduce isolation and improve overall well-being of their client. So moving further with the role of support worker. So the first is mobility and exercise. Home care worker can help client with the safe walking and transferring to prevent falls and injuries. So they can encourage client to do daily exercise as prescribed by physiotherapists to maintain their mobility and strength. So SCS can also monitor any changes in symptoms or mental health in their client, and they can promotely report their concern to the nurse for further assessments. So next slide will be covered by Navneet. Thank you.
Hello, everyone. So, Parkinson disease care is most effective when delivered through a team based approach. Each member of the healthcare team plays a unique role in the supporting of the person with Parkinson's and their family. I will walk through the key members of the team and then share some important resources available in Canada. First is primary care provider, often called a family doctor. It is the main doctor overseeing overall health. They manage regular checkups, vaccines, and other chronic conditions while also making referrals to specialists such as neurologists when needed. Then is a neurologist. A neurologist is usually the one to diagnose Parkinson's disease. They assess symptoms and prescribe medications such as levodopa or dopamine agonist. They also adjust treatment plans over time as symptoms progress. Next is Parkinson's nurse specialist. Parkinson's nurse specialists provide ongoing support and guidance. They monitor medications, check up for side effects, and help improve quality of life through education and coaching. Next slide, please. Next is physiotherapist. They play a big role in keeping people mobile. They work on flexibility, balance, and walking and help prevent falls or freezing episodes. They also teach safe exercises that can be done at home. And is occupational therapist. Occupational therapists support people in their daily activities like bathing, dressing, and eating. They may recommend safety equipment, assess driving ability, and connect client to community resources. And then is the speech language pathologist. Because Parkinson's can affect speech and swallowing, a speech language pathologist is vital. They may use therapies like LSBT loud to strengthen the voice, and they teach safe swallowing techniques and diet changes. Next slide, please. Dietitians adjust meal plans based on the stage of the disease. They help with swallowing issues, constipations, and weight changes, and make sure that medications and diet work well together. And then is a psychologist. Since mental health is often affected, psychologists help manage depression and anxiety through counseling and, when needed, medications. Finally, social workers provide counseling for both patients and families, connecting them to community services and help plan for future care and crisis support. Next slide, please. Um, in addition to healthcare team, there are excellent resources available in Canada. First is Parkinson Canada. Parkinson Canada offers education, advocacy, and both in-person and online support groups to reduce isolation. Then is Parkinson Society of British Columbia that provide education, exercise programs, and even virtual physiotherapy to support balance and reduce falls. Last is the Parkinson Foundation raises awareness and funds through events like moving day walks and provide educational programs for patients and families. To wrap up, Parkinson disease is a progressive neurological condition that affects movement, mood, and overall quality of life. Effective care involves not just medications and therapies, but also safety plannings, emotional support, and teamwork between the client and their family, and the HCA and the broader healthcare team. As support workers, our role is to provide compassionate, person centered care that respects the client's independence while ensuring their safety and comfort. We can also be an important link between the client, their family, and community resources. Thank you for listening. And lastly, are the references here. Thank you.